Welcome to Everything Co-op, bringing you information on how cooperatives can help improve your quality of life. This show is being sponsored by the National Co-op Bank, NCB. The NCB is dedicated to strengthening communities nationwide for the delivery of banking and financial services for the nation's cooperatives, their members, and other socially responsible organizations. For more information on the power of community ownership, visit ncb.coop. That's ncb.coop. Now stay tuned for your host, Vernon Oakes.
Good morning, everybody. This is Vernon Oakes, and welcome to Everything Co-op. I'm your host. Today, we're going to do something a little different. June is Men's Health Month, and I want to talk about a subject that affects millions of families across America, the health disparities experienced by Black, Brown, and Indigenous men. I want to put that in the context that every successful cooperative is also a public health intervention. Every successful cooperative is also a public health intervention. So we're going to talk about what causes these disparities among different groups of men. There is a gap. And it is not simply a medical issue. It is an economic issue. It's a social issue. It's a racism issue. It's a housing issue. It is a food issue. It's an education issue. And ultimately, it is a cooperative issue because the conditions that create poor health are the very conditions that cooperatives seek to change. The conditions that create poor health are the very conditions that cooperatives seek to change. By the end of today's program, I hope you will see the health outcomes are not determined primarily by doctors and hospitals. Instead, they are largely determined by the conditions in which people are born, grow up, work, worship, and age. So let's begin with some facts. The average life expectancy for men is lower than for women. But when we break these down by race and ethnicity, the difference becomes even more alarming. The life expectancy of white men is between 76 and 77 years. Black men between 71 and 72 years. Interestingly, Hispanic men live longer. At least their life expectancy is 79 to 80 years. Native Americans are the lowest. They live between 67 and 69 years. So you've got, let's say, 77 years for white men, 72 years for Black men, 80 years for Hispanic men, and 69 years for Native men. Life expectancy. When a male child is born in America, that's what the expectancy, how long a man will live in America. Average life expectancy. Now, I've had some people on this show that's talked about, like in Cleveland, Chicago, inner city, where Black live, life expectancy may be 10 to 15 years lower than white men in the suburbs. What causes this? Is it genetics? No. It could be some genetics. But the more likely it is the social determinants of health. Social determinants of health. that where black men have higher rates of heart disease, higher rates of stroke, higher rates of high blood pressure, higher rates of diabetes, higher rates of kidney disease, higher rates of prostate cancer mortality. American Indian men have higher rates of diabetes, higher rates of alcoholism, higher rates of suicide, and higher rates of preventable death. The statistics are sobering. A black man is significantly more likely to die from heart disease than a white man. Black men are diagnosed with prostate cancer at a higher rate and are more likely to die from it, twice as much likely to die from prostate cancer than white. Native American men experience suicide rates that exceed the national average. So researchers have repeatedly found that the biggest drivers, those things that causes these disparities of health, are social and economic conditions. Social and economic conditions. So how does a black man live in America? What's the social conditions and the economic conditions? If a black man moves from a neighborhood with poor housing, limited grocery stores, underfunded schools, unsafe streets, to a neighborhood with better opportunities, his health conditions improve dramatically. The genes don't change, but the environment changes. And that's what changes the health outcome. Health follows opportunity. Health follows opportunities. Think about two boys born on the same day. One grows up in a neighborhood with quality schools, safe parks, fresh food, stable housing, access to health care. The other grows up in a neighborhood with vacant buildings, environmental hazards, food deserts, underfunded schools, economic instability. By age 50, they more than likely will have completely different health outcomes, not because of genetics or biology, because of opportunity. So just think about a black man in America compared to white men in America. Black man is always, that's most, not all, but always under stress. Driving while black, walking in a park while black, sleeping in your bed while black. Any activity could end up with the black man being put in jail or killed. And often the death goes unpunished. This is what caused the whole Black Lives Matter movement. So driving while black is like always looking for the police. And if one pulls you over, always concerned what will be the outcome. Will it be that the police will put me on the ground and put his knee in my neck, which is a form of lynching, cutting off the airwaves? If you're walking in the park by yourself or with your dog or jogging, then somebody calling police or somebody harassing you. It's in school, at the job, on the playground. There's always stress. And that stress creates poor health outcomes. Now, if you live in a neighborhood where environmental hazards, too much smoke or ash in the dirt in the water systems, drinking poor water, or you cannot get access to healthy foods, or you can't pay for it if you even had access. Whether your job is you're at the mercy of the overseer, even if it's called a supervisor or some other name, there's always economic instability. So by age 50, these two boys born on the same day and living in different social and economic conditions more than likely will have completely different health outcomes. The one that grows up in a neighborhood with quality schools, safe parks, fresh foods, stable housing, access to health care could live 10 years longer than the young man born in a neighborhood with vacant buildings, environmental hazards, food deserts, underfunded schools, economic instability. Could be a 10-year difference in lifespan. That's sort of like the quantity of life, how much life there is, how long one lives. Then there's the quality of life. How good a life does one live? How healthy is one? When you look at these two boys born on the same day, now they both could be black, or the one that was born in the good neighborhood, safe neighborhood, more likely will be white, and that one in the vacant buildings, environmental hazards, more likely black. And that's what causes the life expectancy differences, these social conditions. The average in America is the white man lives 77 years, 5 years longer than the average black at 72 years. But in some neighborhoods, that is even larger in life expectancy. So I often talk about the dimensions of health. It's 5 dimensions. When one thinks of health, it's normally physical health, the health of our bodies. When that often is looking at how much exercise one gets, what kind of nutrition and food one gets, how much sleep does one get. I'm talking about sound, restful sleep, and what kind of medical care does one have for the body, for the physical being. And that's what, when people talk about health, that's what most of the time people are talking about. But there's also mental health, the health of our minds, particularly how all of this stress affects our minds. And you'll see we have more depression, anxiety, that's caused by the stress. Men, particularly black men, are often taught not to discuss emotional struggles. So a lot of black men suffer in silence. They have these mental, like depression and anxiety, and won't talk about it, won't go to get to a therapist. That seems one thinks is weak. Suffer in silence, and therefore the age keeps getting lower and lower and lower. And the quality of life is worse. Then there's emotional health. After physical and mental health, there's emotional health. And that's the ability to process grief, disappointment, and relationships. Many men are isolated, more so in my father's generation, the World War II generation, than mine and younger men. Younger men are not as isolated as older men, but many men suffer in isolation. Loneliness by itself has become a major health issue. Physical health, mental health, emotional health. Let's go to spiritual health. A sense of meaning and purpose. A sense of meaning and purpose. Connection to something larger than ourselves. our faith, our values, service, community, spiritual health. So often I think, and I would say we think of religion talking about spiritual health. No, it doesn't have to be in a religious sense. Religion is one form of spiritual belonging or spiritual health, but it's a sense of meaning and purpose. Where do you get that sense of meaning and purpose from? Perhaps the church. How about your job? Do you get meaning and purpose from your job? Connection to something larger than oneself. What kind of values do you have? Spiritual health. Now, after physical, mental, emotional, spiritual health, we get financial health. I like talking about money, but it's bigger than money. It's the ability to meet basic needs and plan for the future. Financial stress creates physical stress or illness, okay? Financial stress, financial insecurity increases anxiety, depression, chronic issues. Like financial stress increases mental health, anxiety, depression, chronic illnesses, physical health or mental. And this is just an example that all five of these, financial health, spiritual health, emotional health, mental health, physical health, they're all interconnected. And financial health or financial issues, I have been told, is the number one reasons for divorce. If financial, do you have enough money coming in to take care of your basic needs? Do you have enough money coming in that you can save some for future needs? That future may be retirement, but that future might be a snowstorm or an accident. That future need may be something that you cannot plan for. A hurricane. May not live in an area where hurricane, but you might be driving through. So all of those health dimensions, the five of them, are interconnected. And they all are affected by social determinants. So these social determinants, the World Health Organization and public health researchers refer to these as social determinants of health. These determinants account for much more of our health outcomes than medical care itself or genetics. Economic stability or economic instability. Income affects your housing, your food, your transportation, health care. That financial health, the economics, affects pretty much all of the social determinants of health. Economic insecurity creates chronic stress, chronic illnesses. And talk about financial health. A lot of time people will look at how much money you have coming in, income, compared to how much money you have going out, your expenses. What most Americans, regardless of the amount of income, spend more than they have coming into the house. Not for basic needs. We're trying to keep up with the Joneses or some people buy a car every year, every 2 years. They're spending more than they have coming in. And this economic instability creates chronic stress. Another one is education. Education affects employment opportunities. Not only employment opportunities, but how much income do you get? This income potential. The more education you have, the more income you can expect to get. And the more income you'll likely get. The more income you likely get, the better the housing you have, the food you have, the transportation, the health care. So education is pivotal. And my grandfather, sober or drunk, always told me, get an education, boy. That's the only thing a white man can't take from you. Get an education, boy. Get an education, boy. And in a couple of months, I'll be 79. So I'm already above the life expectancy of white men, black men, and definitely Native American men. I have to get up to 80 to be with Hispanic men. And I would suggest to you that education is a big part of it, of my longevity. There were 7 siblings in my household. 5 are dead. None of those 5 made it to 65. 5 siblings have deceased. None of them made it to 65. Now, my youngest sister and I are only 2 that's still alive from the 7. She is 74, or will be, her next birthday, and I'll be 79 my next birthday. Education, education, education. Get an education. You have more employment opportunities. You have more income potential. And as you'll see when we start talking about co-ops, you can also start your own business. People with more education generally experience better health outcomes because of these social determinants. So you got economic stability, education, then you go to housing. Housing quality directly affects health. In poor homes, you could have exposure to lead, which really affects young people's mind and older people. Mold, the same thing. Mold can also cause breathing issues. Unsafe neighborhoods, which means that there are shootings going on and fightings going on. All of these things, as relates to housing, contributes to poor health. Any of the environmental issues where your house is, and in a lot of Black communities where they put dumping stations, whether that is garbage or, like I said earlier, ash, anything that creates environmental issues that for smell. In Charleston, West Virginia, they had all of these chemical plants. Just driving through it, you could smell it. And after economic stability, education, housing, you got food access. Millions of Americans live in food deserts. Fast food is available in your dollar stores, but fresh food is not. This contributes to obesity, diabetes, and heart disease directly. Healthcare access. Many people delay treatment because they don't have insurance, don't have transportation, or they can't take time off from work, or they lower their income coming into the house. Problems that could be prevented becomes emergencies and or death. Then there's the social connections. Humans need community. We were born out of community, tribes, villages. Isolation is also associated with depression, anxiety, higher mortality rates. Higher mortality rates is life expectancy is lower. Community matters, relationships matters, belonging matters. So our next segment, which we're going to get into, but we may have to take a break in the middle of it, but it's why cooperatives matter. Cooperatives address many of the determinants of health. Worker co-ops. Worker co-ops that employees own and control the business. Worker co-ops The workers create the business. They create the jobs. The workers have voice. And when they have voice, they get dignity, self-respect. This reduces workplace stress, reduces monetary stress, and it builds wealth, financial wealth, community wealth, social wealth, self-wealth. That is your worker co-op. Now, you get into the next group, which we call consumer co-ops. And consumer co-ops or housing co-ops, often they're food co-ops, credit unions, rural electric co-ops. And so in DC, there are approximately 100 what's called limited equity housing co-ops. These are affordable housing. They provide stable housing, create safer communities, strengthen social networks, belonging together. Food co-ops are grocery stores. Most of the time, they're consumer co-ops. Sometimes they're worker co-ops that the workers own it, but most of the time, they are consumer co-ops. Increase access to healthy foods, supports food, local agriculture, and improves nutrition. Food co-ops. And then we have credit unions. Most of the credit unions were formed because the banks would not provide checking and loans in poor neighborhoods or rural neighborhoods. And so that's why a lot of credit unions got started. And then when one saw the benefits of credit unions, even in wealthier neighborhoods, they started credit unions. Credit unions expand financial access, reduces predatory lending, improves financial health. We're going to take our break and we'll be right back. Please don't touch that dial. Welcome back, everybody. This is Vernon Oaks, and the program is Everything Co-op. Our financial sponsor is National Cooperative Bank. They've been with us ever since we've been on air. We're getting to end our 13th year. NCB's mission, National Co-op Bank's mission, is to support and being an advocate for America's cooperatives and their members, especially in low-income communities, by providing innovative financial and related services. And so in all of these different areas that we're talking about, NCB can provide financial services. We were talking about why cooperatives matter and that cooperatives address many of the determinants of health. So we talked about worker cooperatives. We were into consumer cooperatives, that's food, housing, credit unions, rural electric co-ops. But there's another thing here. Co-ops are organizations or businesses that's owned and controlled by its members. Cooperatives are businesses that are owned and controlled by its members. Co-ops are created by its members for the benefits of its members, not for shareholders. And these members of a co-op lives in the community where the business is. So you get this community ownership. People that live in the community own and control the business, whether it's a worker co-op or a consumer co-op. I've said this often in the last 13 years. Dame Pauline Green, she at the time was the president of the International Cooperative Alliance. She said that co-ops bring people out of poverty with dignity. This thing, dignity, okay, is what you get when you get voice, when there's community ownership. Remember, this spiritual health was a sense of meaning and purpose. connection to something larger than yourself. This is this community ownership. It creates this dignity. It gives one voice, participation. You basically have two jobs if you're in a co-op. One job is your regular job, whatever that might be. If you're in a factory like Eco Exchange, and Eco Exchange is getting all of these products from all over the world. They process chocolates. The last I know, they had 150 members. So these members will have their job. It may be somebody on a truck, on a forklift in a factory. It may be somebody that's in sales, that's selling their bananas and their cocoa and their teas and their coffee to stores throughout the U.S., mainly food co-ops, but it could be any store. So you have a job in the business, and then you have the job of running the business. So that's one of the responsibilities of being in a co-op. You do have a second job when you're in a co-op, but the benefits are awesome compared to working in a business where you have no say in your schedule, what work you do, and the safety of the work that you're in. You have no say. There is some boss or supervisor, overseer that's telling you what to do, when to do it, how to do it, where to do it. So you have this community ownership. You have voice. You have participation. And that gives you hope. Boy, hope is so critical. It fits right along with dignity. Hope. Hope for the future. Hope for the family. Hope for the community. And I've watched it in West Virginia, when the mines closed down, and too often they took the pensions with them. The mines in that capitalistic system, they extracted coal from the mountains or timber. They took, but then they took the labor. And too often they didn't give back even what was earned, like in pensions. They left broken mountains and broken people with little hope. And when people have little hope, they medicate themselves. Marijuana, heroin, cocaine, methamphetamines. And then the whole community goes down. Tremendous health issues. Same thing on the reservations. Little hope to no hope. Suicide rates go up. So what can give you the outcomes you want is having control over your life. And this is what co-ops give. It's more control to people, the individual, the one that works there. And this is why I say that cooperative ownership contributes not only to economic health, but also to mental health, emotional health, spiritual health, and physical health. This is why I say that co-ops, they are sort of like a hospital that prevents the disease from happening. So co-ops help that the social determinants of health are improved. And this is why I say that co-ops, a successful co-op, is also a public health intervention. So there's also, besides the social determinants of health, the United Nations has sustainable development goals for all around the world. The social determinants of health sort of outlines the problem. The Sustainable Development Goals, SDGs, also talks about how one can solve these problems, these social determinants of health, what a country must do, what a community must do in order to have better health outcomes. First one is economic stability. We talked about that. Educational access and quality. We talked about that. Healthcare access and quality. We talked about that. Social determinants of health is food security and nutrition. Well, those are the social determinants of health, and that's what we talked about. So the SDG for economic stability is no poverty, decent work, reduce inequalities. And the social determinant of health is education. The SDG number 4 is quality education. Provide quality education. Healthcare access. The SDG number 3 is good health and well-being. And they directly address disease prevention, treatment, and wellness. Neighborhoods and environments. This sustainable development goal is number 11. Sustainable cities and communities, safe housing, transportation, parks, clean neighborhoods, improve health outcomes. Social determinant of health, food security and nutrition. The SDG number 2 is zero hunger. Number 1 is no poverty, the SDG number 1. Number 2 is zero hunger. Environmental quality is a social determinant, and SDG number 6 is clean water and sanitation. Number 13 is climate action, climate control. SDG 15 is life on land. Clean air, clean water, and environmental sustainability affects health. I mean, it's basic needs. Clean air, clean water. Making sure the environmental is sustainable and clean. Social and community access. Context. SDG number 16, peace, justice, and strong institution. You know, if you have trust, safety, civic engagement, it supports mental and physical health. Financial security is social determinant. SDG number 8 is decent work and economic growth. And we've already talked about financial stress is linked to poor physical and mental health. I'd say all 5. Equity and inclusion. SDG number 5 is gender equality. Number 10 is reduce inequalities. Health disparities often follow patterns of discrimination and exclusion. This is why Native Americans and Blacks have lower life expectancy, lower health, because of these patterns of discrimination. The social determinant of partnership and collective action. The SDG is partnership for the goals. Partnership to meet all of these goals. Complex health challenges require collaboration among sectors and communities. And this is nothing but cooperation, y'all. Nothing but cooperation. So the SDG, the United Nations Sustainable Development Goal number 3, is directly related to health. It says good health and well-being. Reduce premature mortality, death. End preventable death. Improve mental health, reduce substance abuse, improve access to healthcare. That's the SDG, Sustainable Development Goal 3. But you have to have all of these other things in order to get the health goal, in order to get number 3. The other 16 Sustainable Development Goals must happen in order to achieve number 3. In order to get good health, you've got to have a good job, a good source of income. You got to have food, nutritional food, housing, all of these things. Live in a good community, have good relationships. So if you get into food co-ops, food co-ops were mainly created by people that were looking for nutritional food. whether that was white folks or black folks, brown folks, if they were looking for nutritional food and foods that the community wanted, create their own grocery store. And the people that shop there, the consumer, normally owned the business. And that meant that they had bylaws, they had legal structure. It is a business. It functions like a business. The consumers voted on the board of directors. The board of directors had fiduciary responsibility. They had the financial responsibility of the business. The members shopped at their food co-op. You didn't always get better pricing, but you got better food. And the food co-op was not there to make a profit for a shareholder. It was there to provide quality food for its members. So if there was a way of creating a lower price, the food co-op would do it. Housing co-ops, they, in SDG goals was sustainable cities and reduce inequalities. But housing co-op is another consumer co-op. We've already talked about it. When you belong, as I do, I belong in they call a market rate housing co-op in Washington, D.C. is 57 units. I was elected on the board, and we decided to have a Juneteenth party on the 19th. And we had food, and we paid for a band, a DJ, and we had drummers, African drummers, and dancers and speakers, and we paid for them. The board decided to have a Juneteenth celebration. We didn't have to go ask the master or the owner. Normally, if it's an apartment building, it's somebody that's a landlord that doesn't live in the community. Didn't have to go ask. We planned it out in our budget. We planned to spend the money in our budget. So we create a budget around October, November, get it approved by the members. Okay, and that budget said this is where we would spend money. And we had conversations. Some people didn't want to have the Juneteenth celebration because they were concerned it was going to raise their carrying charge. Because whatever you put in the budget, you have to pay for. Okay, and that means you figure out all of your expenses, insurance and maintenance of common areas and landscaping and snow removal, fixing the gates and everything. You look at all of these expenses and you say, this is how much it's going to be. And you've got 57 units. You divide by the square feet of each unit because each unit is not the same size. And you get what the carrying charge will be. Mine for a one bedroom is $405 a month. And that include in that $405 money for Juneteenth. Now we could decide to have other things, other celebrations. We've been talking about a movie night. We just sent around a guy to inspect all water because the water bill was going up. So we had to pay for the guy going around and doing that. And every beginning of every summer, we have a person go around and clean out the drainage for the HVAC systems. All of that's in the budget. So this is a housing co-op. And because we have control over our space, we have community. I say I know about half of the people in here, in this community, maybe a little bit more. Ask about their children, their spouses, how they're doing. It's community. Like growing up in Bluefield, West Virginia, where you knew most of the people and you said hi. So all of this helps to create positive health outcomes. We've already talked about worker co-ops. Decent work, no poverty, are the goals from the United Nations that worker co-ops help to address. Co-ops lead to better health. Co-ops intervene. You may have a poor neighborhood, maybe even bad neighborhood. You can put a worker co-op in there, and the people that do the work and shop there will have better outcomes because they have voice. Co-ops have 10 values and 7 principles. And I say if a co-op is a co-op, they operate by these values and principles, regardless of what's in their name. So cooperative values and principles. The values of a co-op are, okay, the first one is self-help. I always find that interesting. Start with self in a group. Self-help, self-responsibility. There are responsibilities to be in a co-op. I talked about that already. Basically have 2 jobs, doing your work and running the business. Democracy, 1 member, 1 vote, or is a democratically controlled group. So you have, again, voice, equality, equity, and solidarity. So it starts off with self-help and self-responsibility. And the last one of the first 6 is solidarity. But the ethical values of honesty, openness, social responsibility, and caring for others. And I particularly like the caring for others. That helps when everybody is caring for each other. That helps to have less negative health outcomes or better health outcomes. And then these values put into action give you your principles. Voluntary and open membership. It does not care about where you were born, whether you're born male or female, whether or not you are a Democrat or Republican, whether or not you're in a church or synagogue or not. It just doesn't care what age you are. Do you want to work in an organization and live by those values? You want to do and be responsible. And then there's democratic member control, and that is 1 member, 1 vote. That's easy. 1 member, 1 vote. And then there are decisions that's made by the membership, and then there are decisions that are made by the board. The members say, here's what things you board can make decisions on. The everyday operation. Well, you hire staff to take care of the everyday operation of the business. Okay. And the board then manages that staff. And then there's member economic participation, which is a huge one. You pay a membership fee to get in, but when there's a profit, you get dividends. And the members decide how much of the dividends they get and how much stays in the business and how much may go to help the community. Then there's autonomy and independence. You have to have control. Governments can't have control. Financial institutions can't have control. The members must have control. And the one I like best, number 5, because I've said to you, education, training, and information. Education is key to good health outcomes. Education is key to good financial stability. And then there's cooperation among co-ops, an ecosystem of co-ops working together, whether they're worker co-ops, consumer co-ops, marketing co-ops, purchasing co-ops. It doesn't make any difference. We work together. And the 7th principle is concern for community. This is why co-ops are health interventions. Health disparities are not inevitable. They are results of decisions about housing, education, food systems, economic opportunities, healthcare access, and community investment. If we want healthier Black, brown, and indigenous men, we must address the conditions that shape health. That means investing in communities. It means building wealth. It means creating opportunity. And it means expanding democratic ownership through cooperatives. The cooperative principles, especially education Corporation Among Co-ops and Concern for Community offer a framework for building healthier people and healthier communities. I want to thank you for joining me today. Cooperatives are not just a business model created by the members for the benefits of the members. It's a pathway to dignity, opportunity, and health. So I want you to think about how you can join a co-op or start a co-op, how you can have better health for you, your family, and your community. And I'd say to you, we'll see you next Thursday. Please live cooperatively and live healthier.